I've provided patient privacy and performed hand hygiene. Hi, my name is Rachel. I'm going to be your nurse today. Can I check your wristband?
Sure.
Okay. And can you verify your name and date of birth for me?
Anne-Marie Stone, 060299.
Okay. According to the Dr. Miss Stone, we're supposed to do a physical assessment on you. Have you ever had one done?
No.
Okay. Basically, we're just going to check you up and down just to make sure that everything's functioning correctly, okay?
Okay.
All right, sound good. All right, I just have a few questions for you before we get started. Number one, do you have any allergies?
No.
Number two, are you in any pain?
No.
All right, and number three, do you mind if I touch you throughout this examination?
Sure.
Okay, awesome. That means yes, right?
Yes.
Okay,
Yes.
cool,
Yes.
cool. All right, let's get started. Go ahead and just tell me your name one more time.
Anne-Marie Stone.
Okay, do you know where you're at?
The hospital.
All right. Do you know what year it is?
2020.
Okay, and do you know who the president is?
Trump.
Okay, so patient's speech is clear. Patient is calm and cooperative. Patient is alert and oriented ×4. All right, next, Miss Stone, I'm going to have you look straight ahead.
Okay.
What I'm going to do is shine a light in your eye. Just keep focusing on the back wall here. Okay? Alrighty. Next thing I'm going to have you do is look straight at the pen. Just concentrate on the pen for me, okay?
Okay.
Okay. And if you will stay staring at the pen for me and just follow with your eyes, not your head, okay?
Okay.
Okay. So patient is Perla bilaterally. Okay. Miss Stone, do you wear any glasses or contacts?
Contacts.
Okay. And what's your vision with them?
2025.
Okay. So normally we would use a Snellen chart, but for these purposes we don't have any. So the next thing I'm going to have you do is I'm going to cover up one of your ears. I'm going to whisper into the other.
Okay.
And if you can just repeat what I'm saying out loud, okay?
Okay. Cake.
Okay.
Cow.
Awesome. Okay. And you don't wear any hearing aids, correct?
No.
Awesome. Let's see. Next thing if I can have you do is just if you'll stand up and walk to the wall and back.
Okay.
All right. Patient's gait is steady with arms swinging beside sides. You can go ahead and sit down for me.
Okay.
All right, Miss Stone, do me a favor and smile for me. Oh, you have such a pretty smile. Face is symmetrical as well. Okay. Next thing is I'm gonna check your carotid arteries. Okay. Yeah. Go ahead and put your hair up for me.
Okay. Sorry.
No, you're good.
Okay.
Okay. Okay. You can feel the carotid pulse bilaterally. We're going to check for bruit, which is basically just like a whoosh sound. Okay? Okay. No bruit is noted. Okay, let's see. Next thing we're going to do is listen to your lung sounds, okay?
Okay.
And if you will, as when I just put this on you, if you will just take a deep breath in and deep breath out, okay?
Okay. I'm sorry, it's ticklish.
It's okay. just turn around for me.
Okay, no problem. Oh, I'm sorry. Excuse me.
I'm gonna do 2 more.
Okay.
Sets.
Yeah, no problem.
Okay, you can turn back around for me.
Okay.
So, patient's breath were quiet, effortless, and rhythmic. All right. Next thing I'm gonna do is check your heart sound.
Excuse me. I'm sorry.
Okay. So, for heart sounds, you got the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. Okay? Alrighty. Here we go. Mid-clavicular line, 5th intercostal space. Okay. And at this point, too, if the patient was taking a medication such as digoxin or had an irregular heart rate or pulse, then you would take the apical pulse for 1 minute. The next thing that I'm going to do is check your lymph nodes, okay?
Okay.
Alrighty. So, you got the occipital, which is in the back. Then you have the posterior cervical, which is the back of the neck. The anterior cervical, which is basically the front of the neck. The submandibular, the submental, and supraclavicle. Okay, so there's no enlargement of the lymph nodes. Okay. The skin is uniform with the rest of the body. Skin color is appropriate for race. Let's see. Okay, if I can have you lay down now.
Okay.
Okay. So no JVD is noted when lying supine, and if you could raise 45 degrees. Okay. No JVD noted at 45 degrees either. Okay. The next thing we're going to do is listening to your abdominal sounds. So we're going to start here, 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 here. Okay. Okay. Intermittent gurgling sounds heard times 4. Typically, you would hear about 5 to 30 per minute. Okay, the next thing I'm going to do is palpate. And you just tell me if it feels tender at any point, okay?
Okay.
No?
Nope.
Okay. I also need to self-correct. I don't remember if I said S1, S2 with no murmur, but there was no murmur. Okay. Next thing I'm going to have you do is bend your knees, and if you can, have your feet on the bed for me. Okay. Squeeze for me. Okay. Pull apart. All right. And if you could push up. Yeah, okay. Push down. Okay. Go ahead and sit up for me. Well, actually, if I'm going to have you to stand, that'll be great.
Okay.
Okay. And if you can just rotate your hip outward on both sides. Okay, and rotate your hip inward on both sides. Perfect. And if you can hold your arms out and rotate them. Perfect. Okay, if you can hold your arms like that. And if you'll push. All right. If you'll pull. All right. Shrug your shoulders for me. Okay. And if you will, walk on your tiptoes to the wall and walk on your heels back. Okay, perfect. The next thing I'm going to have you to do is grip my hands for me. There you go. All right, and if you'll sit down for me.
Okay.
And if you will, hold on to your hands. So what I'm doing here is checking her capillary refill. It is less than 3 seconds. Okay. Patient's skin feels warm. Okay. The next thing I'm going to have you to do is, if you'll just kind of sit back on the bed.
Okay.
Okay. Check your patellar reflex, okay? Okay. Patellar reflex bilaterally. Okay. Posture is erect. Okay. The next thing I'm going to do is check your pulses, okay?
Okay.
So we've already checked the carotid. So the next one is the brachial. So yeah, perfect. Okay, brachial pulse felt bilaterally. Then you got the radial. Okay, that is felt bilaterally. The next would be the femoral, but that is in the groin region. The next is popliteal, which is on the back of the knee. Okay, that is felt bilaterally. Then you got the posterior tibialis, which is behind the ankle. That's felt bilaterally. And then the dorsalis pedis. And that is felt bilaterally. Okay. Let's see. Okay, last thing I'm going to do is I'll have you close your eyes, okay? I'm going to show you something that's dull. I'm going to show you something that's sharp, and you just tell me where it is and what it is when we begin. But here's dull,
Okay.
Okay?
Okay.
And this is sharp,
Okay.
Okay? You ready?
Yes.
All right, so,
Dull chest.
okay,
Sharp arm.
okay,
Dull thigh. Sharp shin. Dull foot.
okay. Let's see. So yeah, skin is appropriate for race. Get the face, shoulders, chest. Okay. Do you have any questions for me?
No, ma'am.
Alrighty, this concludes our assessment. Before I leave,
Sorry.
I'm going to leave the bed lowered and locked with the side rails up ×3 and call light within reach. And I'm going to document. I'll be back in an hour, okay?
All right.
Alrighty. Thank you.